Now medical assistant test prep. Question 1. A medical assistant realizes after a patient has left the office that she forgot to put the patient's complaint of a sore throat. Which of the following choices would best correct her error? Option A, pull out that page of the chart and rewrite it with the correct information. Option B, put one line through the original chief complaint, write error. Your initials and today's date, make the correction by rewriting the CC with the correct information. Option C, go to the next available line of the SOAP notes, write the current date, then late entry. Place the date and time when the patient stated she had a sore throat, sign and date the entry. Option D, all of the above are incorrect. The correct answer is option C. Go to the next available line of the SOAP notes, write the current date, then late entry. Place the date and time when the patient stated she had a sore throat, sign and date the entry. A late entry is the proper way to add information discovered after the original documentation time. It preserves the integrity of the record by showing when the note was added and when the information was obtained. Question 2. When filing using the terminal digits method, which would be true? Option A. The filing is done using the last 1 or 2 digits of the patient's medical record number. Option B. It is the simplest way to file. Option C. The patient will acquire multiple charts. Option D. All of the above are false. The correct answer is option A. The filing is done using the last 1 or 2 digits of the patient's medical record number. Terminal digit filing organizes charts by the last 1 or 2 digits of the medical record number. This distributes files more evenly and improves retrieval in large filing systems. Question 3. Out guides are used when? Option A. Charts need to be labeled appropriately for ease of retrieval. Option B. Charts have been removed from their filing location. Option C. 2 patients have the same name and their charts must have distinguishing marks. Option D. None of the above. The correct answer is option B. Charts have been removed from their filing location. Out guides mark the location where a chart was removed from the file system. They help staff track who has the chart and where it should be returned. Question 4. A patient presents with vesicles covering the upper torso. Which of the following situations could cause this condition? Option A. Knife fight. Option B. Auto accident. Option C. Sunburn. Option D. Fungal infection. The correct answer is option C. Sunburn. Vesicles are small fluid-filled blisters and can occur with sunburn or other skin irritation. Knife wounds and accidents are more associated with lacerations or trauma. Question 5. A child is diagnosed with a green stick fracture. Which of the following most accurately describes the broken bone? Option A. Compound fracture of the fibula. Option B. A partial break in a long bone. Option C. Fracture of the growth plate of the ulna near the wrist. Option D. Call's fracture of the tibia. The correct answer is option B. A partial break in a long bone. A green stick fracture is an incomplete or partial break in a long bone, commonly seen in children. The bone bends and cracks rather than breaking completely through. Question 6. When reading a lab report, you notice that a patient sample is described as having anisocytosis. Which of the following most accurately describes the patient's condition? Option A. The patient has an abnormal condition of skin cells. Option B. The patient's red blood cells vary in size. Option C. The patient has a high level of fat cells and is obese. Option D. The patient's cells are indicative of necrosis. The correct answer is option B. The patient's red blood cells vary in size. Anisocytosis means red blood cells vary in size. It is a laboratory finding often associated with different types of anemia or abnormal red cell production. Question 7. One of the 3 smallest bones in the body is the Option A. Femur. Option B. Distal phalanx of the small toe. Option C. Stapes. Option D. Coccyx. The correct answer is option C. Stapes. The stapes, located in the middle ear, is one of the smallest bones in the human body. It helps transmit sound vibrations. Question 8. A patient is having a colposcopy procedure performed. How should the patient be instructed to prepare for the procedure? Option A. NPO for 8 to 12 hours before the procedure. Option B. Hold all hormones for 2 days prior to the procedure. Option C. Take 3 Dulcolax tablets and 2 containers of Miralax the day before to clear out the lower GI system. Option D. None of the above prep is necessary for this type of procedure. The correct answer is option D. None of the above prep is necessary for this type of procedure. A colposcopy usually does not require fasting or bowel preparation. Patients may receive specific instructions, but none of the listed preparation steps is routinely required. Question 9. Which of the following organs would be described as being located retroperitoneally? Option A. Kidneys. Option B. Thymus. Option C. Small intestines. Option D. Spleen. The correct answer is option A. Kidneys. The kidneys are retroperitoneal, meaning they lie behind the peritoneal lining of the abdominal cavity. The small intestine and spleen are intraperitoneal structures. Question 10. The heat-regulating center of the brain is the option A, hypothalamus, option B, pituitary gland, option C, pons, option D, medulla oblongata. The correct answer is option A, hypothalamus. The hypothalamus regulates body temperature and helps maintain homeostasis. It receives temperature information and triggers heat loss or heat conservation responses. Question 11. A patient with Bell's palsy would have which of the following complaints? Option A, paralysis of the right or left arm. Option B, malfunction of a certain cranial nerve. Option C, a subcondition of cerebral palsy. Option D, a side effect of a stroke. The correct answer is option B, malfunction of a certain cranial nerve. Bell's palsy involves dysfunction of the facial nerve, cranial nerve 7, causing facial weakness or paralysis. It is not paralysis of an arm or a form of cerebral palsy. Question 12. A pathologic condition described as increased intraocular pressure of the eye is: option A, detached retina, option B, fovea centris, option C, presbyopia, option D, glaucoma. The correct answer is option D, glaucoma. Glaucoma is characterized by increased intraocular pressure that can damage the optic nerve. Early detection is important because vision loss may be permanent. Question 13. The anatomic structure located in the middle of the heart which separates the right and left ventricles is the option A, septum, option B, sputum, option C, separator, option D, none of the above. The correct answer is option A, septum. The septum is the wall that separates the right and left sides of the heart, including the ventricles. This separation helps keep oxygenated and deoxygenated blood from mixing. Question 14. Which of the following bony landmarks is described as a large blunt irregularly shaped process such as that found on the lateral aspect of the proximal femur? Option A, tubercle, option B, tuberosity, option C, condyle, option D, trochanter. The correct answer is option D, trochanter. A trochanter is a large, blunt bony projection, such as the greater trochanter of the femur. It serves as an attachment point for muscles. Question 15. MSDS sheets. Option A, contain the ordering information for each piece of equipment in the office. Option B, are required by OSHA to be accessible to all employees of the office. Option C, can be used to treat patients who have been injured in equipment accidents. Option D, none of the above. The correct answer is option B, are required by OSHA to be accessible to all employees of the office. Safety data sheets, formerly MSDS sheets, must be accessible to employees under OSHA hazard communication requirements. They provide information on chemical hazards, handling, and emergency measures. Question 16. The most virulent bloodborne pathogen is: choose the best answer. Option A, HCV, option B, HBV, option C, HIV, option D, HIV. The correct answer is option B, HBV. HBV is considered highly infectious among bloodborne pathogens and can survive outside the body longer than HIV. Vaccination is an important protection against HBV exposure. Question 17. The NFPA diamond has 4 colors. The blue diamond, option A, indicates hazards to health. Option B designates that it is safe to use water to put out this type of fire. Option C indicates that ice is necessary to treat an injury with this type of chemical. Option D indicates that the chemical may be incinerated upon disposal. The correct answer is option A, indicates hazards to health. The blue section of the NFPA diamond indicates health hazards. Red indicates flammability, yellow indicates reactivity, and white identifies special hazards. Question 18. A patient has been told to monitor her LH levels. Which of the following potential conditions might the patient be suffering from? Option A, anemia. Option B, Graves' disease. Option C, menopause. Option D, infertility. The correct answer is option D, infertility. LH testing is commonly used when evaluating ovulation and infertility concerns. Abnormal LH patterns can affect reproductive function. Question 19. Manual hematocrits are done. Option A, to monitor anemia. Option B, by using a microhematocrit tube. Option C, to measure the percentage of plasma to cells. Option D, all of the above. The correct answer is option D, all of the above. Manual hematocrit testing uses a microhematocrit tube and measures the proportion of blood volume made up by red blood cells. It is commonly used to help evaluate anemia. Question 20. The best blood collection location for a newborn is: Option A, the AC, Option B, the veins of the forehead, Option C, the heel, Option D, the fingertips. The correct answer is Option C, the heel. For newborn blood collection, the heel is the preferred site when performed correctly. Antecubital and fingertip sites are generally not preferred for routine newborn collection.